Hi, this is Dr. Doreste with the Cranial Release Technique, and I wanted to continue the conversation about CRT in children. I've gotten quite a few comments and questions about the need for children, infants receiving cranial release technique. So again, I just wanted to follow up and dig a little deeper on the previous two chats that I did here on Facebook. So again, after the birth process, here's a plastic model of a baby's skull. After the birth process, whether it's a natural birth process, C-section, forceps, chances are there's been trauma to the baby's skull. And a simple way that you can determine that is just to look at the baby's skull, look at the newborn baby, and look at the eyes, and you'll probably see one eye smaller than the other, and one eye lower than the other, one eye smaller than the other. If you took your fingers and just placed them in the baby's ear canals, you will probably see something like this. You'll see rotation, front to back, one ear to the other, or you'll see one ear higher than the other. All signs of cranial distortion. And you say, well, how could that be? The baby's just a day old, a few hours old, a week old. Again, we have to go back and we have to look at mom's cranium. If mommy's cranium is distorted, that will cause a distortion throughout mommy's body, certainly affecting mommy's pelvis. So as mommy's pelvis is distorted, and the baby is now growing in a warped environment, the chances are the stresses being placed on the baby's skull will be imbalanced. One side will have more stress, one side will have more compression, and all these things, then it's time for delivery. As the baby's head passes through mom's birth canal, there's compression of the baby's skull. This is normal, this is natural. Again, nature knows best, and if nature knows best, the reason why we go through that birth process of compression and then decompression, according to Dr. Sutherland, who's the founder of Cranial work, is that compression and decompression was the kickstart. Sort of when you start the lawnmower, for lack of a better word, or you start an engine and you give it that pull, that kickstart. Well, that kickstart of the birth process passing through mommy's birth canal is Mother Nature's way to kickstart the primary respiratory mechanism. We covered this on some of the other videos. Dr. Sutherland's concept that the cranium is moving, it's normal, it's natural, and that as the baby's head passes through the birth canal, there is compression, 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 the head exits, and then there's decompression, kick-starting this mechanism. That mechanism, which will follow us through the rest of our life, is vital for optimal health. So if you're sitting here watching this video and you're a teenager, or you're in your 20s or your 50s or your 80s, the question you may be asking is, how would I know if my primary respiratory mechanism is functioning optimally? And so again, the same test that we use with the baby, you could just do with yourself when we're done with this video. Just go take a look in the mirror. And you'll probably see one of your eyes looks a little bit smaller than the other, right versus left. You'll probably see that one of your eyes is lower than the other, right versus left. You'll probably notice that your ears, one ear either sticks out more, one ear is more forward or anterior than the other. All those three little indicators that I just covered are all indicators of cranial distortion. And then you say, well, so what? Well, the so what is because the cranial bones have shifted, that primary respiratory mechanism, that involuntary pumping mechanism that Dr. Sutherland described, will be reduced, will be weakened. And that will lead to overall dysfunction or imbalance throughout your body. If we want to dig a little bit deeper, covering the brain and spinal cord, we have a membrane. It's called the dura mater, Latin word for tough mother. And so here's a plastic model of the dura, and as the cranium shifts, this dura, which is separating the brain hemispheres and separating part of the brain from another part of the brain, will twist and distort because it's attached to the cranial bones. And as that twists and distorts, there's no way that the brain inside this cage, if we use the plastic model, which should be fully open, giving your brain and my brain maximum area to live, which is now getting compressed, one eye small, one eye low, ears rotated, and the brain is now living in this sort of closed cage. There's no way the brain can function optimally. So the point of cranial release, the reason why I'm making these videos, is for the practitioners that are watching this to understand that if you're giving a chiropractic adjustment, if you're doing a massage, if you're applying needles and you're an acupuncturist, if you're writing different prescriptions of vitamins and natural supplements and herbs, all things that I think are fabulous, but you're missing the cranial concept, then to me, you're really missing the main player in the game. If you would take the time, invest in learning how to apply cranial release to your patients, balance this cranium first, then do your adjustment, then do your massage, then apply the needles, then give them the supplements that you think they need. In my experience, all those things will function better because now the cranium, the central nervous system, will be functioning optimally. It will be more open to receiving whatever therapies or whatever modalities that you happen to be offering to your clients. If you are a potential patient, you're someone out there, you're not a practitioner, you're saying, gee, maybe that could help me with my migraines. Maybe that could help me with my sciatica. Maybe that could help me with my whatever, fill in the blank, my bowel issues, my dysmenorrhea, my whatever. And you'd like to experience cranial release. What I'd like you to do, very simple, just go to the website, cranialrelease.com, and there's a button there that says find a practitioner and search in your area. Hopefully there's someone in your area so that you can go and experience cranial release. For the practitioners, you can go to the same website, cranialrelease.com. There's a button there called free report. You should order a free report, get some videos and some more deeper understanding about cranial release. You could also always contact me at info@cranialrelease.com. My phone number's on the website. Feel free to call me if you'd like to discuss this. If you'd rather talk as opposed to email back and forth, whatever way works for you, works for me. So, as someone just posted here, we're all on a mission to help this planet get more into balance. And if the cranium of all of our population, over 7 to 8 billion people, if the craniums are distorted, how could we possibly have a balanced world? Cranialrelease.com. Find a practitioner. If you're looking for a practitioner, there's a button for online training if you'd like to learn this work. And I look forward to speaking with you down the road. Again, start looking at patients. Start looking at your friends, your family. When we're done, or next time you go to the mirror, go take a look at yourself. Look at your eyes. Look at your ears. Look at your cheeks. You're probably going to see distortion. And that distortion, I can tell you, is a sign for me that there is imbalance within the central nervous system, and you really should be seeing someone that knows how to apply the cranial release technique. Thank you so much for watching. I hope to talk to you and see you again down the road. And if you have any other comments on topics you'd like for me to discuss, just type them down below and I'll cover them on my next live broadcast. Thank you so much for watching. You have a fabulous day. Dr. Doreste, cranialrelease.com. Bye-bye.